Hi, I'm Dr. Peters with Peters Wellness, Chiropractic and Massage, and this week's quick video is in regards to our elderly populations, our senior citizens. I try to think of people, 65 and older, 70, 80, 90 and beyond. And I have a handout this week in the office, and it talks about the widespread back pain in the senior population, and different reasons for that. Maybe it's inactivity, maybe it's a history of car accidents and injuries and things like that. But what I want to think about is when we have people come into our office, whether they're 12 years old or 80 years old, I'm going to put them through a series of tests. These neurological Zess, I do 100 of them, and the reason is I want to get a foundation. I want to find out where they're at. So their pain levels may be a 2 out of 10, meaning not very bad. You may be an 8 out of 10. So sometimes we may need to order x-rays, MRIs, CT scans, whatever it is. But testing them neurologically and seeing where they're at foundationally. If someone fails 50 out of 100, obviously they're in much worse condition than someone who only fails 20 out of 100. So we talk about elderly population. A lot of times we think of degeneration, osteoarthritis, degenerative joint disease, degenerative disc disease. Well, and people think of these, well, it's normal as you get older. Well, not necessarily when you're 60 or 70. Now, orthopedic studies show 100, I believe it's 110 to 115 years before our joints should really start to show degeneration. But now you take into effect high school and college football, gymnastics, all these different things, motorcycle accidents, slip and falls. Obviously the degeneration is going to happen faster. So people who haven't had as many injuries may not have as much degeneration. Then you take into account idiopathic scoliotic curvatures and things like that, and that can have an effect, especially if a person hasn't been under care over their lifetime. But idea of the elderly population is keeping active, but even with our younger people now, people are not as active as we used to be. And I recently read a book called The Miracle Morning by I think it's Hal Elrod, The Miracle Morning. My neighbor gave it to me, and I still need to call her and thank her. It's not new information, but it's packaged in a really neat way. And we're talking about a gentleman who had quite the life experiences and is very grateful to be alive. But they talk about that, the way Tony Robbins says it, that hour of power in the morning. What are you doing your first hour of your day? And reading it got me motivated to do a better job in the morning, to be more on task. And he talks about lifesavers, and the savers being having some silence, doing affirmations, visualization, exercise, reading, and then I believe like scrolling or journaling and putting your thoughts down where you want to be. And I think I pulled it up here. Jim Rohn, one of my favorite people who isn't with us anymore, but one of his favorite quotes that made me think of, if you don't have a design for your life plan, chances are you will fall into someone else's plan. And guess what they have planned for you? Not much. So have a plan, and the morning time is a great time to have that morning. And it doesn't matter if someone is 16, 18, 40, or 70. If you don't have a goal that you're striving for, a purpose in life, how depressing would that be? It's like, oh, what are you doing next week? What are you doing next year? Oh, not much. Boring. How about having a plan? We're going to travel to Europe. We're going to go to Greece. We're going to go to Hawaii, and we're going to stay on the islands for a couple of weeks, whatever it is. But having a plan and a goal, and as we get older, to me, those goals are even more and more important, not the reverse of that. So if you have someone you know and love and care for is having low back pain, because I wouldn't want to travel if I'm in agony and pain all the time. So have them visit a chiropractor in their area. Get checked, have them look at things, and within 3 to 4 weeks, they could be feeling so much better. So that's the message for this week. Have a great week, and we'll see you next time.